Hello, good evening. I'm Dr. Neha, who's the Health Promotion Lead at National Cancer Society of Malaysia. So today, y'all are streamed into our FB Live to actually dive deep into the HPV vaccination program that is being run by National Cancer Society of Malaysia. And also, we're going to look at how important it is and why do we need to be vaccinated. So let's go straight into our talk today. So the program that we are running currently at National Cancer Society is Leaving No One Behind, which aims to prevent cervical cancer in Malaysia, meaning to say this is one of the most preventable and treatable cancer whereby we have a vaccine to eliminate cervical cancer. So let's go deep dive into this. So I am Dr. Meha, and I'm more than happy to teach you guys about the three most important things today, which will be on human papilloma virus. So what it is, what kind of diseases it can cause, what can HPV virus, and what is the linkage to cervical cancer, and how important is this HPV vaccination. So our key take-home message from this talk today is going to be about HPV and cervical cancer, as well as human papilloma virus vaccination. Okay, so let's learn about human papilloma virus, which is known as the HPV. HPV is a type of DNA virus, and it is usually transmitted via sexual activity and also intimate skin-to-skin contact at the genital area. Genital area means your private parts. So currently, there is about 200 subtypes that has been identified, which can cause infection in both the sexes, meaning both men and women are equally susceptible to get or to contract this HPV virus. Okay, so what are the diseases and cancers that are related to HPV infection? So we can divide it into the mucosal or the genital infection site, or we can categorize it as the non-mucosal or cutaneous infection site. So at the genital sites, these high-risk HPV types as well as the low-risk HPV types can cause genital warts, can cause cervical, anal, penile, vaginal, vulva, and oropharyngeal cancer. So anywhere through your reproductive system, including your cervical canal, your penile, vaginal, vulva areas, and all that, you're prone to get cancer with this high-risk HPV types, which is known to be the 16, 18, 31, 33, 45, 52, 58, and many more others. All right. Whereas the low risk HPV types are not related to cancers, but however, it can cause warts in your genital area. So it can be even on your plantar, palmar areas, other skin warts in your body, as well as you can still get genital warts. Next slide. Okay, so what types of cancers can this HPV virus cause? So as we learned earlier, we have got the high-risk HPV strain as well as the low-risk HPV strain. So we know that the high-risk HPV strains are the one that can cause cervical or any sorts of other cancers as mentioned earlier. So when our body is exposed to these high-risk HPV strains, it infects the skin cells. So later on in the long term, it turns to become precancerous and then subsequently becomes a cancer site. So as you know, high-risk HPV strains can cause nasopharyngeal, which is over the nasal area. Oropharyngeal will be from your nasal tract up to your trachea, your digestive tract. Cervical cancer would be more on the reproductive side of any ladies, vulva and vaginal cancer as well, whereas anal cancer and penile cancer is more commonly seen in male. Next slide. Okay, so these are the HPV related cancers and diseases that I think I've mentioned earlier. So any sort of cancers, including cervical, vulva, vaginal, penile, anal cancers can be caused by these HPV high risk strains, as well as genital warts, which is caused by the low HPV strains. Next slide. Okay, so who is at risk of developing this HPV infection. So basically, nearly all sexually active individuals are at risk of getting infected by this HPV virus. But those individuals who are higher risk of getting this HPV infection includes those with previous infection, HPV infection or exposure, if they are smoking, or even if they have become sexually active at a younger age, has got a weak immune system, such as having conditions as HIV, any use of medications that that can cause immunosuppression, as well as if an individual has undergone an organ transplant, meaning to say that they will be on immunosuppressant medications for some time, and this makes that individual much more susceptible to HPV infection. So basically, everyone who's sexually active can get infected with this HPV virus. Okay, so when you get the HPV infection, is there any signs and symptoms which are obvious? The answer is no. At any early stage of HPV infection, you might not see any obvious signs and symptoms. But however, if that HPV infection is persistent or it turns into chronic infection at the cervix, it can lead to abnormal changes to your cervical area over years, which can only be detected through cervical screening methods, including your pap smear as well as your HPV DNA test, which I will speak about it later. All right, so can this HPV infection be treated? There is no specific treatment for HPV infection itself, and in most common cases, once we are exposed to the HPV virus, our body's immune system is able to clear this HPV infection within 1 to 2 years' time from the initial HPV infection. Let's say this infection is not cleared within the first 1 to 2 years, it will persist or it will continue to stay in our body. And subsequently, over a period of 5 years, it will turn to become a precancerous lesion. And up to 20 years, that's when you develop your cervical cancer. So one most important take-home message that we can see from this entire chart is that from the initial point of contracting HPV virus or the infection till it develops to become cancer, it takes almost about 20 years. So can we do something about this? As I mentioned, cervical cancer is one of the most preventable and treatable cancer. So early vaccination, getting your girls being vaccinated at the appropriate age against HPV virus, as well as getting screened on a regular basis can help detect cervical cancer at a very much earlier stage. 20 years, it gives you ample of time and opportunity to get yourself vaccinated as well as getting screened. Next slide. Okay, next, earlier we learned all about HPV virus and what are the diseases and conditions that are associated with HPV virus. Now we are going to move on to another topic, which is very important for ladies as well as spouses who has wives, daughters, and also children, okay, of girls. So we're going to learn about HPV and cervical cancer. All right, so let's talk about where the cervix is. It is actually in the lower part, most lower part of the uterus, which connects the womb to the vagina, which is the birth canal. So cancer happens in where the cells in the body tends to go out of control. It starts multiplying in an abnormal manner, starts eroding to the nearby structures, as well as transferring to the other parts of the organ. So when the cancer cell starts in the cervix, develops, it is called as cervical cancer. All right, so the image on the left, you can see how does a normal cervix looks like. It looks pretty much very smooth and also very pink. Whereas in cervical cancer, you can notice that the surface is very rough. It's very friable. So any contact to the cervix can cause easy bleeding. And as you can see, there is multiple lesions seen on the cervix. It is not a pretty looking picture as compared to a normal cervix. Okay, so basically, as what I mentioned earlier, how does a normal cell develop to become cervical cancer over years? So once a person is being exposed to this HPV virus, all right, it takes about 1 to 2 years for the body to automatically remove this virus from the body. But if it persists and it can turn to become any precancerous lesion of low abnormality or high grade abnormality. So when there is an abnormality in the cells, only pap smear, which is the screening method for cervical cancer, can help to detect the cell changes that has occurred. All right. And if we leave it untreated, as I mentioned, it will tend to become an abnormal lesion where the cells will start growing abnormally and starts eroding to adjacent structures. And it will become a much more it will become a cancer which is quite difficult to treat and also monitor the progress. All right. So based on the statistics of cervical cancer globally and also in Malaysia, cervical cancer is ranked as the fourth most common cancer in women, and uh, the estimate of new cases are about 600,000 cases in 2020. All right. And it accounted for about 341,000 deaths, meaning to say, if you have got 600,000 cases being diagnosed in 2020, it led to almost 50% of death in that year itself. All right. And about 90% of these new cases and deaths, which was captured in year 2020, occurred in the low and middle income countries. All right, so we need to understand that this is not a very rare cancer. It is a very common cancer among women, and the rate of mortality, death rate, as well as the incidences are pretty much very high. And as I mentioned, is there a solution for the cervical cancer? Yes, get your children or your girls being vaccinated against HPV vaccine, as well as going for routine screening when they reach the screening age. Next slide. Okay, so this is basically a graph to show that how common is cervical cancer in Malaysia. As I mentioned earlier, in the global scale, it is the fourth most common cancer among women, whereas in Malaysia, it is ranked as the third most common cancer among ladies. As you can see, breast is the leading cancer in Malaysia among females, followed by colorectal, and the third one is cervical cancer. So it is not that it's a rare cancer. It is very pretty much common among ladies in Malaysia. Okay, so what is the issue here? Despite knowing the statistics, despite knowing what can cause cervical cancer, despite knowing what are the treatments, what are the prevention methods and all that, it is very sad to mention that almost 41% of cervical cancer cases were detected at late stages. What I mean by late stages is stage 3 and stage 4. And as you can see, the numbers is comparatively in 2007 to 2011 was much more lower compared to when we compare it with 2012 and 2016. So meaning to say, there is few cases which are detected in stage 1 and stage 2. Why does this happen? Probably they're unvaccinated, as well as they do not go forward for their routine screening. So once they're detected at late stages, if they come to a doctor and ask, what are my treatment options? Yes, we do have treatment options available for these patients. But if in terms of prognosis, how well can I cure? How well can I walk out the room without this cancer? The chances are pretty much lower if the cancer is being detected at a late stage. Okay, so this is just a graph to show you the 5-year survival rate. So meaning to say, when it is detected at a very much early stage, which is stage 1, stage 2, you can see that the survival rate is close to about 75% as compared to the cervical cancer, which is diagnosed at stage 4. It is as low as 23%. So early screening, early detection saves life. All right, this is a very important message that everybody needs to take note, because without having this awareness on cervical cancer, the HPV vaccine, and also routine screening, I think we will tend to observe the rate of survival decreasing as the time pass by. Right, next slide. Okay, so what are the signs and symptoms when we talk about cervical cancer? Any sort of vaginal bleeding or discharge. Let's say if you're having after sexual intercourse, even in between of your menstrual cycles, as well as when you're menopause and you notice any spotting or any heavy bleeding, please look out for your doctor. All right. Any sudden loss of weight and appetite, which is unintentional, also needs to be paid attention to. Any persistent back pain, leg, or even pelvic pain, this is an alarming sign. And let's say you have got swelling, you just feel very fatigued, you don't feel your usual self. Okay, this is all the signs and symptoms that you need to be aware of. And if you experience any of these signs and symptoms, please do not hesitate to speak to your gynecologist, or even your doctors that you're comfortable with. All right, next slide. Okay, so do we have, as I mentioned earlier, we spoke about the HPV vaccine, we spoke about cervical cancer and HPV. Now we're going to talk about how can we screen for cervical cancer. Is there a method? Yes, we have. And currently we have two methods, which is called the pap smear test, which was a much more conventional testing for cervical cancer. And also now we are moving towards HPV DNA test. So a pap smear is usually where the doctor or nurses inserts a speculum, which looks like a duck mouth, into your cervix, and they will scrape off the surface of your cervix to collect some cells to be examined under the microscope. So how early can you start this pap smear test? It is as early as 21 to 65 years old. You need to do it yearly for the first 2 consecutive years. And if it turns to be negative, you can do it every 3 years once. All right. Whereas for the HPV DNA test, it is commonly said to be like a COVID test. All right. So this swab test is what we will insert into the cervix, all right, to be tested for any infections or to detect various types of HPV that can lead to cervical cancer. So all sexually active women between the age of 30 to 65 are encouraged to do this test. And the duration or the interval of the screening is every 5 years once. HPV DNA test is a very simple test. It can be self-collected, or even your healthcare professional can do this test for you. Okay, so when it comes to screening, it is to detect any abnormalities before the disease happens. Whereas a diagnostic method means there is a confirmed abnormality which is suggestive of cancer. So in that cases, we will do a colposcopy. All right. Colposcopy is basically inserting a camera through your cervix to see the surface of your cervix, how big is the lesions, and etc. Okay, this is usually done by a gynecologist, whereas a biopsy is to take the sample of the cervix if there's any abnormality detected during the colposcopy test. All right, biopsy is done to test whether the cells that has been taken from the surface of the cervix, is it cancerous or not? We need to detect that. Next slide. Okay, so the treatment options are surgery, radiotherapy, and as well as chemotherapy. So once you're diagnosed with cervical cancers, the doctors or the oncologist who's in charge of you will discuss your treatment options. So please ask any sort of questions if you are unsure of the treatment that you're going through. Are there any alternatives? And is there any fertility sparing treatment options out there? So all this needs to be discussed with your doctor. Next slide. Okay, as I mentioned earlier, HPV cervical cancer is one of the most preventable and treatable cancer because HPV virus can be prevented through HPV vaccine. Almost, and also from this graph, we can see that almost 95% of cervical cancer cases are caused by the HPV infection. And it takes pretty much a very long time, as you can see the curves. It takes about close to 10 to 15 years before it develops from a precancer to a cancerous lesion. Next slide. Okay. So do we have a protection against cervical cancer? The answer is yes. HPV vaccine works the best as it provides almost 100% protection from HPV virus. And next is we need to go for regular cervical cancer screening as mentioned, which is your pap smear, or you can also do a HPV DNA test. And also you need to adopt a healthy lifestyle. Okay, next we're going to touch about a very important subject matter, which is the HPV vaccination, as this is in conjunction with the Leaving No One Behind program that is being carried out by National Cancer Society of Malaysia. We are reaching out to vulnerable communities that has girls between the age of 13 to 20 years old. We will be providing on-site vaccination for free of charge. So all we need is a group of girls who has not been vaccinated, who we think could be from the marginalized pocket or an underserved community. Please do reach out to us and we'll be more than happy to vaccinate them. Next. All right, so HPV vaccine. So what does it do? By you receiving this vaccine, it provides protections against the various HPV subtypes as discussed earlier. All right, so once this vaccine is injected into the body, it will stimulate the body's immune system to produce antibodies to fight this HPV infection. So one dose of HPV vaccine contains about 0.5 ml and it is administered as an intramuscular injection at the shoulder pad. Deltoid is called the shoulder pad. Right, next slide. Okay, so how does this HPV vaccine work? So once a person receives this HPV vaccine, the immune system will respond by producing antibodies to fight the HPV virus. These antibodies will build up in our body without causing any infection or reaction in our body per se. And this will act as your soldiers when you are exposed to the viruses, and it will help to eliminate or remove these viruses from our body. All right. So the immunity will be built towards HPV once an individual gets their HPV vaccine. Next. Okay, so what are the types of HPV vaccination which is out there? I do understand parents who has children who's going to school. I understand KKM have restarted their program and all that, but let's just go through what are the different types of HPV vaccine which is out there. All right, the typical HPV vaccine that we have is called the Cervarix. It's a bivalent vaccine. It helps to protect against two strains, which is HPV 16 and 18, which is termed as the high-risk HPV strain that can cause cervical cancer. And it's available for it's available for females only. Whereas now, in conjunction with our Leaving No One Behind program, we are administrating HPV Gardasil 4 vaccine, which is a quadrivalent vaccine. So what it does is it protects against 4 different strains of HPV virus. So 6 and 11, which are known to cause genital warts, whereas 16 and 18 it usually causes cervical cancer. So this vaccine can be administered to both males and females. And lastly, we do have the Gardasil 9 vaccine, which is a 9-valent vaccine. It protects against 9 different strains of HPV virus, and this is much more expensive. All right, per dose, the cost of it is almost 500 ringgit, and this is available for both males and females. Next slide. Okay, so what are the indications? Who can take this vaccine and who can't take these vaccines? So individuals from the age of 9 up to 45, we do provide this vaccine, and they are eligible ones to get the vaccine. And for both boys and girls up to age of 26, they're recommended to get this vaccine as early as 9 years old, all right? And till the age of 20, they only require 1 single dose, whereas for 20 and above, they require 2 doses. All right, we do not need to vaccinate individuals beyond the age of 45. All right, they just need to monitor by doing routine screening. All right, what are the contraindications to this HPV vaccine? All right. If, let's say, an individual has developed a severe allergic reaction from their previous dose or to any vaccine component, they are not supposed to get this vaccine because we are afraid that this HPV vaccine might trigger the similar reaction in them. Any pregnant women, as well as any moderate to severe acute illness without fever, all right? Ideally, the vaccination should be delayed until the illness is cured. So meaning to say, any moderate to severe acute illnesses, it's not that they are prohibited from getting the vaccine. It's just that we need to delay the vaccination till they cure themselves. All right. If let's say they are having any severe allergies, including allergies to yeast and all that, it's best that you consult your doctor before getting your vaccine. Next. Okay, so the most important question that parents should be asking, should my child get the HPV vaccine? Yes, all children, meaning to say girls and boys, should be vaccinated with the HPV vaccine because both genders are equally susceptible to the HPV virus. It's just that the diseases and cancers that are related to two different genders are different. So according to WHO, it recommends that each children should get their vaccine at the age of 9 to 14 years old because the immune response is much more stronger at this time and the vaccine is much more effective if it is given before the person is infected with HPV virus, which is usually contracted to sexual activity or intimate skin to skin contact. All right. Okay, so what is our current practice according to the Ministry of Health? So any individuals from the age of 9 to 20, they only require a one-dose vaccine, whereas for those beyond the age of 20, they require a two-dose vaccine. Okay, so what are the possible side effects? Because parents might be very curious to know if their children happen to take this HPV vaccine. So what are the potential side effects that I would need to monitor for? So first is definitely any sort of pain, redness, or swelling on the injection site, any fever, headache, tiredness, nausea, muscle pain or joint pain, any dizziness or fainting. And not to worry, usually the side effects of HPV is pretty much very similar to any sort of vaccines out there. It has not known to cause adverse or very severe side effects. All right, so this is it's a very localized side effects from the HPV vaccine. And usually once you get the side effects, it will disappear within a day or two. All right. Next. So these are the much more adverse side effects of the HPV vaccine. And as you can see, the most common side effects as what I mentioned earlier, pain, redness, swelling over the injection site, muscle soreness, tenderness, and all that. And then the much more rare symptoms which are on the higher up of the pyramid, which is the Guillain-Barré syndrome or any anaphylactic reaction. Anaphylactic reaction is a severe reaction due to the allergy. So meaning to say the child might experience a shortness of breath, swelling over their eye, their lips and all that. So, and this is a very rare condition where it only happens in 1 in 100,000 girls or individuals receiving this HPV vaccine. The most common ones are on the lower part of the pyramid where we can see generalized pain, redness, swelling and all that over the injection site. Next. Okay, so how safe is this vaccine? Generally, HPV vaccine is a very safe vaccine because there was more than 15 years of monitoring and research done to ensure that this HPV vaccine is safe and it's suitable to be administered to humankind. All right. As you can see, Gardasil 9 was studied in a clinical trial for more than 15,000 individuals consisting of both males and females. And it was also studied in subsequently, it was studied in a bigger clinical trial groups, 29,000, and Cervarix was studied in more than 30,000 females. So all the vaccines, the types of vaccines that I've described earlier has gone through a thorough monitoring and research to ensure that this vaccine is safe to be administered. Next. Okay, So, as I mentioned earlier, HPV vaccine works extremely well. The protection is almost close to 100%. And when we look at the prevalence of HPV 16 and 18, from those who have received the vaccine and from those who have not received the vaccine, okay, this is observed between the girls aged between 13 to 19. So we can see a significant decrease of almost 83% for those received the vaccine and those who did not receive the vaccine. And between the women aged between 20 to 24, all right, there is a 66% drop in uh, the types of HPV 16 and 18 being detected after receiving the vaccine. All right, so the protection that HPV vaccine gives, it lasts for more than 10 years without becoming less effective. So it is a one-off lifetime protection against your cervical cancer. Okay, lastly, HPV vaccination is very safe and effective, and you need to get your kids or your girls or boys vaccinated now to protect them against HPV related cancers that we learned today. Okay, so this is just a brief description of our Leaving No One Behind program, which aims to eliminate cervical cancer in Malaysia. So as we know, it is the third most common cancer in Malaysia, and the most common causative agent is the HPV virus. All right. And in National Cancer Society, we will be carrying out this program complementary to the efforts of Ministry of Health as part of their national immunization program. And HPV vaccines that is being conducted by National Cancer Society will be given out to more vulnerable and underprivileged communities living in all 222 parliamentary constituencies across Malaysia. So if you happen to know any girls between the age of 13 to 20 who has not received their vaccine, if they come from a B40 community, chronically ill, persons with disabilities, lives in reform centers or even prisons, single mothers, orang aslis, orang asals, primary school dropouts, please do reach out to us because we are more than happy to provide this vaccination for them, because our main aim here is to not leave anyone behind, and we want to eliminate cervical cancer in Malaysia. We can do this if we hold hands together to make a change in this country. Next. Okay, so this is going to be debunking the myths, all right, around HPV vaccine. All right, let's go into it. So how can this HPV vaccine affect us? All right, let's learn more about it. Next slide. Okay, so there's a lot of rumors which says that the vaccine is very unsafe. All right, so before getting the FDA approval, almost 60,000 people were studied to ensure that this vaccine is safe. All right, and they have been observed on a close monitoring post-vaccination at hospitals that has conducted these clinical trials. And after the licensing by FDA that has been approved, almost 70 million doses of vaccines have been given out in almost 80 countries where the safety monitoring was done, and there was no serious safety concerns that is alarming to the public. So is vaccine safe or unsafe? The answer is the vaccine is very much safe to be given out to the eligible individuals. Okay, next, vaccine is very unnecessary unless you're sexually active. All right, so as we all know, prevention is better than cure. The vaccine works the most effective if it is given to an individual before they begin their sexual activity or before they come in contact with their HPV virus. So in younger people, it helps them to create the antibodies to the vaccine in a better manner, and it protects a better protection. And almost everyone will be infected with HPV at any point of their time. And if it's given at a much more younger age, it is much more effective as it provides 2 times protection at the age of 14 compared to when you receive it at 15 years old. So the earlier you give them the vaccine, the more protection and more effective the vaccine would be. Next, we're going to debunk the third myth. Is the vaccine only for females? All right. So as we mentioned earlier, both genders are susceptible to this HPV virus, and 4 in 5 humans will contract this HPV virus at any point of their life. And vaccination of boys will ensure that they are less likely to spread this HPV virus to their future partners. And what are the benefits for men? All right, it protects them from genital cancers caused by HPV, and also cancers that can occur in the throat, penile area, anal, and also genital warts. So this HPV vaccine provides protection to both males and females as well. That's like, okay, the fourth myth. The vaccine doesn't work, or in another word, it's not effective. All right, this vaccine is known to be 100% effective, and in a clinical trial that was conducted among those aged between 16 to 26 years old, where we managed to get about 20,000 of them. And in these women who had the high risk HPV infection, which is the 16 and 18, there were no abnormalities seen. All right, there were no precancerous lesion that was detected in them, even though they are exposed to the high risk HPV infection, which is the 16 and 18. And in male, the effectiveness is about 90%. All right, and what it protects them, or where does it work the best, is it prevents genital warts as well as abnormalities associated with penile cancer. Next slide. All right. The next myth, vaccine encourage sexual activity. No, this is not the message that we're sending across. The vaccine is pretty much very effective. And when we administer this vaccine before they begin their sexual activity, it works the best, and it helps to protect them from any sort of sexually transmitted diseases as well as HPV related diseases. All right. So there is no issues with once they get the vaccine, they might have an earlier onset of puberty and all that. So that is not true. Okay. Let's go to myth number 5, number 6. Okay, so vaccine encourage sexual activity. The answer is no. It provides protection before they begin their sexual activity. That is the key note or the key message that needs to go across. All right, next slide. Okay, so what about this vaccine? Does everyone know about it? And from my recent conversations with parents as well as the communities out there, more than 50% of people out there have no idea of these HPV vaccines. And almost 60% of them are parents with kids. So if the parents do not have the awareness or even the knowledge about HPV vaccine, what can HPV virus cause and all that, the children might be the ones who are going to be suffering in the future, because it's the role of their parents or the guardians to ensure that the kids, regardless of their gender, girls or boys, to have the protection against this HPV virus. All right, next slide. Okay, so are we doing enough? So we do understand that it's vaccine hesitancy after the COVID pandemic, but we need to understand that this HPV vaccine is a different ballgame. It's not an emergency vaccine. It was tested about 5 to 10 years under monitoring and close research. And it is very important that parents need to understand why is this vaccine so important to their children. All right, if you are refusing the vaccine, probably for other reasons that you need to do a research on it, your child is too young, you think that the vaccine is not safe, your spouse or your relative has said that this vaccine does not provide protection, is very harmful to the children, you have your own doubts, all right, please do speak to a doctor, because the benefits of this HPV vaccine is pretty much higher when you compare to your benefit of doubts. All right, next slide. Okay, so the next myth is this vaccine can kill people. All right, so almost 100 million doses were given out, and there were 14 deaths observed worldwide. So what were the cause of that? It was not due to the vaccine, but whereas it was caused by the car accidents, suicide, any other comorbidities that that person has actually had. All right. And adverse reaction and side effects is very pretty much similar to the other sort of vaccines. And the most common ones are like the pain, redness, swelling at the injection site. All right. Severe allergic reactions, if it happens, we need to, it needs to be consulted by a doctor. But it is a very rare phenomenon that we see with HPV vaccine. Next slide. Okay, vaccine causes infertility. All right, so this HPV vaccine actually works to protect your fertility because it prevents you from cervical cancer. As you know, the cervix is the gateway between your uterus as well as your birth canal, which is your vagina. So if you have a cancer there, it can harm your unborn child even when you're pregnant. All right. So it prevents gynae problems related to cervical cancer treatments. And also it prevents possible cervical complications with pre-cancer treatments. All right. So it does not promise you to have healthy babies because you don't have cervical cancer, but it helps to protect your fertility. All right. Next. Okay, so does the vaccine effectiveness wear off? All right. So currently, there is no studies which says that the vaccine effect will wear off, but currently we are still also observing them. All right. And also when there is a reduction in your antibodies and all that, okay, it's no issue. You can also still get a booster. All right. When the long-term immunity wears off, that's when we give the booster. It's similar to your hepatitis B vaccine as well. All right. Time to time, we observe the antibody levels, and when the antibody levels drop below a certain level, we do get boosters, right? So it's similar to HPV vaccine. Okay, so the last one, does this vaccine contain harmful ingredients? All right, like all other vaccines, it has got a component of aluminium, which is also found in your breast milk, infant formula, antacids, your medications, and other food products. All right. The aluminium content in this vaccine is very, very low. It only contains about 0.225 milligrams of aluminium per dose. And the safe amount of aluminium that can be ingested by any adults is from 7 to 9 mg of milligram per day. And this vaccine has been reviewed and is found to be safe by the Global Advisory Committee on Vaccine Safety, WHO. So not to worry, even though it consists with a very minimal amount of aluminium, it is a safe dose and it will not cause any sort of adverse reactions. Okay, so question here, if you have already vaccinated, right, do you need to get a pap smear or a HPV DNA test done? The answer is yes, you still need to do your routine screening because vaccination acts as your primary prevention. All right. Whereas secondary prevention really pretty much it lies on your screening methods, which is through your pap smear as well as your HPV DNA. All right. Next. Okay. So these are the cervical screening guidelines. So you can start from the age of 30 to 65. You can do pap smear every 3 years once and HPV DNA test every 5 years once. All right, so this would be your secondary prevention, which is through your cervical cancer screening. Next slide. Okay, so again, I would like to emphasize that HPV vaccination is very safe and effective. Get vaccinated now and protect yourself against HPV-related cancers. Next. Okay, that's all from me. All right. I would like to thank National Cancer Society of Malaysia to be providing me this opportunity to spread awareness as well to educate the public out there regarding cervical cancer as well as the prevention method. All right. Thank you. Okay. Hi, Melinda. I have got two questions. Question number one, my 17-year-old daughter received a total of 5 jabs, 3 from the private and 2 under schools in 2019. Now her school is offering HPV 4 in 1 jab again. Should she take this jab again? Does she need to take new HPV vaccines? 9 in 1. All right. So basically, if your daughter has received her HPV vaccine, all right, looking at it, she has received 3 doses and subsequently she has received 2 under schools. And now she's being offered with the HPV Gardasil 4. All right. Ideally, she does not need to be vaccinated again. All right, because she has already had adequate protection and also the necessary vaccine during earlier school days. All right. Question number two. My 11-year-old daughter has not had a period yet. Should she receive the jab now or wait till her period has started? Okay, this is a very good question. All right. So cervical cancer and HPV vaccination, all right, it does not have anything to do with your daughter receiving, your daughter getting her period. So as early as 9 years old, as I mentioned earlier, they can start getting their vaccine already. So we do not need to wait till she has actually got her menses. Okay, so what are the effects of contracting HPV for men and does it lead to any specific cancers? So in my earlier slides, I did mention that this HPV virus can both infect men and women. All right, so once they become sexually active or even having intimate skin to skin contact over their genital areas, they are susceptible to contract this HPV virus. But in men, it causes genital warts, anal cancer, penile cancer, oropharyngeal cancer, nasopharynx cancer. It is not cervical cancer. It is other sorts of cancer that can affect the men. Yes, men can contract HPV, and over a long run, probably in 10 to 20 years, if the infection persists, it can develop to the cancers that I mentioned earlier. Okay, thank you for this wonderful session. I hope we had an insightful session by learning what is HPV virus, what are cervical cancer, as well as HPV vaccination. So please get your daughters, your kids vaccinated against HPV. All right. So please reach out to your healthcare professionals and also at National Cancer Society. We do provide free HPV vaccines for girls aged between 13 to 20. Thank you very much for your attention today.